price of staying healthy doubled overnight. For many families across Colorado, that's no longer hypothetical. It is happening. This week on Real Talk with Micah Smith, we'll look at what's behind the surge in healthcare premiums. Plus, we'll share personal stories that reveal the real cost of losing coverage and who is paying the price. Welcome to Real Talk with Micah Smith. I'm your host, Micah, and I am so glad to have you with us. For many families across Colorado, healthcare is already one of the biggest monthly expenses. And for people who don't get insurance through an employer, the cost can be overwhelming. This year, that burden has grown even heavier. Hundreds of thousands of Coloradans saw their health insurance premiums skyrocket at the beginning of this year. One major reason is that Enhanced Affordable Care Act subsidies expired at the end of 2025. Those tax credits helped make coverage affordable for millions across the country. In our state, the Colorado Division of Insurance says they helped around 100,000 people enroll in coverage they could actually afford. When that federal help disappeared, so did the financial safety net for many local families. The state estimated about 80,000 Coloradans would lose coverage without those credits, and that Coloradans who buy their health insurance through Connect for Health Colorado saw average net premium increases of 101% starting January 1st. But behind those numbers are real people forced to make impossible choices about their health and finances. We want to start by hearing from one of them. Joining us now to share her personal experience with rising premiums is L.B. Wilson. Elle, thank you so much for being here.
Thank you for talking about the Affordable Care Act.
Before we talk numbers, start by telling our viewers who you are and what kind of health insurance you rely on.
I'm a realtor. I'm a 1099 employee. I'm part of the workforce, just a regular person. I live and work up in Summit County, Colorado. I rely on my health care. The Affordable Care Act is really my only choice for insurance. There's no private insurance I can go to outside of the Affordable Care Act. I have some choices inside of that within the state, but I rely on it for my health care.
So when did you first learn your premiums were going up, and what was your reaction?
Well, I've been following this pretty closely. So I've been listening to Congress, hoping and praying that Republicans and Democrats would figure something out before, January 1st when the premiums went up. And they kept saying it will, it might, it could. In November, I learned that my premium would go up about $500. It doubled, a 50% increase. And I just was hoping and praying that everyone in Congress, please change it. Change the Affordable Care Act, make all the changes you want, but I was hoping they would have the wherewithal and the vision to not make us pay for it while they debate. Please keep it as it is for a year, 2 years, 3 years, I don't care, but figure it out. But don't, on January 1st, $500 out of my pocket more, double $6,000 more in 1 year, $6,000 increase.
And we're talking $6,000 more on top of what you were already paying.
Yes.
What has that done to your budget?
Well, it's really messed up my budget a lot. And so I'm going through, seeing what kinds of things I can get rid of, subscriptions, all of that kind of stuff, as well as, I'm going to be able to survive this. I will be okay. It will go into retirement savings or in my budget personally, any kind of travel, etc., going out, entertainment, things like that. I'm going to be able to survive it, but a lot of people aren't going to be able to survive it, and they're going to have to choose between their kids and their health care, and food and all of those priorities. It's really a drastic increase, drastic.
I'm holding this piece of paper, and it is a letter that you sent to elected officials really expressing your worries, your fears, and how you feel overall about not extending these premiums while finding a permanent solution. Would you mind just hitting some of the highlights of this letter and things you really wanted to drive home to elected officials?
I would love to. Thank you for the opportunity. I just think a lot of people have their own private health care, so they aren't aware of how everything, how it works in general. So as a sole entrepreneur, I can only go to the Affordable Care to get my insurance or get drastic insurance coverage, like if there's something horrible that happens to you. Those are the only two options. I think that people don't realize that it actually started deduction. My health care went up January 1st from $1,000 a month to $1,500 per month for my coverage. Mine and every other person, not everybody in the Affordable Care Act has subsidies. I think there's a lot of misconception. They think that everyone is subsidized. The subsidies are there to help people, but also if you don't need help, there's no other choices as well. I don't think they realize that this is where the workforce actually goes to get their health care. And I feel like they're putting politics ahead of their citizens. People are going to lose their lives. People are going to die. People aren't going to be able to make their premiums. And I think they're playing political games, and I would just call on Democrats, Republicans, independents, every public servant, and also all of us, all citizens, to really see that, it's a really big deal.
Yeah.
It's not a game.
When it comes to this issue, what is your greatest fear?
My greatest fear is that also already, January 1st, I don't know, I think people will drop their health care coverage. Mm-hmm. And I think that's going to cause huge problems. So a lot of people will be uninsured. I'm all for the changes. Please make changes in the Affordable Care Act. But a lot of people are going to be not insured now. It's going to overburden our hospitals and ER. It's going to, which will only drive premiums up even more. So I'm just really concerned about the health and the well-being for normal people.
Yeah, this is very much a bipartisan issue.
It is.
And you are calling on our congressional delegation, our state leaders to come together on this.
I am. It's really, and if you want to put somebody's name on it, please put somebody's name on it. I don't care. It's really about providing health care for all of us.
Yeah. Obamacare or Trump care, you just want health care.
I want health care. This isn't about that. This is about, like, I'm in a fortunate position that I don't have a cancer surgery or something scheduled. Mm. There's people that it's really going to be a problem for.
Yeah. Well, L.B. Wilson, thank you so much for sharing all of that with us and for joining us for this Real Talk.
Thank you for paying attention to this matter.
Elle's story is one of thousands across Colorado. Coming up, I'm sitting down with Connect for Health Colorado to break down real numbers on what we're seeing statewide and who is being hit the hardest. This is Real Talk with Micah Smith. Welcome back to Real Talk with Micah Smith. You just heard how rising health insurance premiums are impacting real people in Colorado. Now let's take a look at the broader picture. State lawmakers did take steps last year to try to address sky-high health insurance rates. During a special session in August, lawmakers passed a measure to lower rates by expanding state premium assistance and reinsurance programs. This helped reduce rates from the very highest projected increases, but did not make up for the loss of federal subsidies that expired at the end of 2025. Many families are paying significantly more or struggling to stay covered at all. Now we're getting a clearer picture of how all of this is playing out. Connect for Health Colorado, the state's official health insurance marketplace, recently released new data on this year's open enrollment. I sat down with Connect for Health Colorado CEO Kevin Patterson to talk through the numbers. Kevin, thank you so much for joining us for this Real Talk. But what are the enrollment trends for Colorado so far this year?
Well, Micah, I really appreciate the opportunity to be with you today. This year it was really interesting. We've had 5 consecutive years of record-breaking enrollment. here in Colorado. And this was the first of those 5 years where it's broken. And we're down about 2%, about 277,000 at the end of open enrollment this year. So we had expected a larger drop, but I think because of some other state policies, we were able to at least keep our enrollment pretty close to where we were this time last year.
All right, so maybe not as bad as expected. Last fall, your office and the Division of Insurance suggested that even more people might choose to go without insurance, and that's due to costs. Is that the case with just the 2% drop? And what exact policies have maybe impacted that?
So a lot of things have happened with a 2% drop. It's very complicated. We're still going through some of the analysis, but it's really clear right now that we've lost a number of folks that just simply couldn't afford it. A lot in our rural communities, Montrose County, their premiums went up over 179%. And up by Dinosaur, up around Craig, Moffett County, they saw large increases as well. And what was interesting is as you look at those that are 55 and above, especially in rural communities, that's where we lost about 5 or 6%. And so where we had made really large gains, folks that are early retirees just trying to live on their fixed income, it really presented a struggle for them. And so we've just seen a lot of those drops. The other thing we've seen is double the number of cancellations. So someone comes in, they might pick a plan, but they say, I think I'm going to stop paying this particular month. And so that has almost doubled from last year. So we've had more new people, but also we've had a few people that are just saying we've got to buy groceries and rent and housing.
That is tough. You mentioned rural communities, people 55 plus in those rural communities that you're seeing the largest impact. What about in urban areas? Is there any demographic or group where you're starting to see a shift?
We're still going through some of that right now. There's just a lot of moving parts. And so I think we're going to come back with our end of open enrollment report at end of March, early April is usually when we're prepared to do that. But one of the things that we did see a lot of is people were just shopping a lot. And so one of the things that we were able to do is we have an Explorer tool that was new this year. And we saw from our brokers, our assisters, our certified application centers, folks just coming in, and they would come in, they wouldn't purchase right quick, they kind of go back, figure out what they were going to do, and they'd come back and then make their purchase later. So that was a new kind of dynamic we hadn't seen in the past. I think people were just really taking their time, getting the right information, trying to figure out how to make the kitchen table economics work, and then they would come back and make their decisions.
Does Connect for Health Colorado have any financial support that you're able to provide?
Yeah, so I think one of the things that's really important is from the legislature in special session last year, the Colorado Premium Assistance was hugely, I think, impactful to keep as many people as we did. And so that was the program that the state passed that gave $80 per member in a household. And then for any additional person, they get another $29 per month off of their insurance. And so we heard from brokers and assisters that made a pretty significant difference in people making a decision to keep care when they could.
And what resources are available for people who did not enroll in health insurance for 2026?
So there's other programs that brokers and assisters usually will help people figure out. And those are just really depend upon where you are, what your status is. There's so many other pieces to it. That's why we send people to those certified application centers in hospitals, brokers, and in community-based organizations. A number of those are sisters that we fund and provide support to.
We heard from someone earlier in the show that talked about how much her premiums have gone up with the expiration of subsidies and how it's really, really tough. What is something that state lawmakers or even our congressmen and women, senators, what can they do to try to make this an easier situation for people who really want to be insured?
Yeah, I think we've seen evidence that people really do want to have health insurance. Affordability is key though. And at the end of the extension for the enhanced premium tax credits, those are just really components that the state can't fund. It's just too big of a dollar amount. And so for the last little over a year, I've been going back and forth to DC to make that pitch to our delegation and anybody else that will listen, because it makes a meaningful difference for Coloradans.
For those who want health insurance, but they feel like this is too much, this is hard to navigate, this is really expensive, I just can't afford it, what would you say to maybe encourage them or maybe have them take a second look at what's available here in Colorado?
You know, that's such a good question. I've talked to so many small businesses or people that their employee coverage changed at work and it doesn't cover their family. And so I've talked to folks that have come to the exchange and they tell me two things. One, I didn't know it was going to be this easy because we actually have some tools. We have professionals that can help you get there. But also, when you shop and you look for a plan that actually works for you, it's actually not as expensive as some people might have anticipated. So just ask. We have our call center, we've got our website, we've got a number of different ways through the community, folks in their community that can help them. So we just try to meet people where they are and see if we can't actually get them to take just a second look.
All right. Kevin Patterson, CEO of Connect for Health Colorado, thank you so much for joining us for this Real Talk.
My pleasure to be here.
We did reach out to the Colorado Division of Insurance for an interview. Insurance Commissioner Michael Conway sent us a statement saying in part, quote, "This is not simply a budget issue. Health coverage saves lives. Short of extending the enhanced premium tax credits, we will work with our state legislature to find solutions for Congress's failure." We know there's a lot of misinformation also shaping this debate. Up next, how policies and politics are impacting healthcare for Latino and immigrant families in Colorado. This is Real Talk with Micah Smith. Welcome back to Real Talk with Micah Smith. Today we're talking about how the expiration of Affordable Care Act subsidies is impacting people right here in Colorado. In the federal policy fight over whether to extend the tax credits, some Republican leaders have tried to blame Democrats for wanting to give health care access to undocumented immigrants. That argument is misleading. Undocumented immigrants are not eligible for ACA marketplace coverage or federal premium tax credits under federal law. What is true is that federal policy changes do affect lawfully present immigrants and their access to subsidized coverage. I want to understand how policy debates are playing out for Colorado's Latino and immigrant communities. So joining me now is Jamie Peruano, Help Program Manager for Servicios de la Raza, a nonprofit that advocates for culturally responsive, essential human services. Jamie, thank you so much for being here.
Of course. Thank you for having me here today.
First, tell us about the HELP program at Servicios de la Raza and who you serve.
Of course. So HELP stands for Health Enrollment, Literacy, and Promotions Program. We provide free, culturally and linguistically relevant health education, health referrals or screenings, referrals, and as well as, of course, health enrollment and benefit programs. We do serve both Spanish and English-speaking individuals and families across Colorado.
That is such an important service. There's a lot of confusion right now from what we're seeing just in this work. Who is actually being affected by the expiration of ACA tax credits and who's not?
So the majority of Coloradans who enroll through the marketplace are being affected, especially those who received financial assistance in the past. You know, we've seen that over 80% of individuals who enrolled in the past have received tax credits. Compared to this year, only 69% of individuals have received assistance. We've also seen an increase of about 83% of people are canceling their insurance for this new year. And we believe that the reason for that is because, you know, of the reduced assistance and the high prices of the insurances.
That's such a large percentage of people canceling their insurance. Yeah.
Yes, we've never seen such a large number before.
Very concerning. How are lawfully present Latino and immigrant families in Colorado being impacted by these policy changes?
Yeah, so lawfully present Latino and immigrants are also experiencing the high premiums for their insurances and a lot of uncertainty about whether they still qualify for financial assistance or not. So, you know, a lot of these families are having to decide between paying for their health insurance each month or paying for basic needs like their groceries. And so this is creating a lot of stress and tough decisions for families.
I imagine so. Have you all been hearing kind of this saying going around that somehow undocumented immigrants are benefiting. Is that something that you've been hearing at Servicios?
No, not at all. Undocumented immigrants do not have the option, to apply for financial assistance. So their insurance premiums are extremely high if they want to buy health insurance plans. I've seen, $600, $800, even $1,000 a month for an insurance plan for someone that's undocumented.
Wow. That's incredible. How does misinformation, though, about undocumented immigrants affect trust and enrollment in healthcare programs?
People, when they hear incorrect information about what they qualify for, their eligibility or consequences, they become scared to seek care or even ask questions. And this doesn't just affect one person; it impacts entire families and communities.
Wow. When we talk about being scared to seek care, does that include maybe emergency situations where literally someone is clearly in pain or hurt and they don't want to seek it out?
Yes, we've had families that, don't go to the doctors even though they're having emergency, life-threatening events happen to them because they're scared of what's going to happen if they step a foot inside a hospital.
For people watching who are worried or unsure, what help is available through Servicios de la Raza right now?
Yeah, of course. So if anybody is concerned or unsure, we encourage them to contact Servicios de la Raza directly. Our services are free and they're confidential regardless of your legal status. And so what we do is we'll, sit with you one-on-one, talk about different options, explore special enrollment period, tax time enrollment, or alternative options if traditional health coverage isn't an option for you. And I think the most important thing is that you don't assume that there isn't an option out there for you. Speak to someone that can help you.
Yeah. You mentioned open enrollment was a very busy time. Can you talk to me about maybe how it was a little bit more difficult this year?
Yeah, so we were very busy with open enrollment. Families were coming in like they usually do to, reapply and look at what they qualify for. And what we were seeing is that a lot of families were just not able to purchase their insurance and they had to cancel because of how high the prices were for them. We also saw that a lot of them just left the coverage for their children so that at least their children are covered.
So they're making a choice between themselves or their children, and they're choosing their kids.
Yes.
That is a tough choice that nobody should have to make.
Yes. No.
Jamie Peruano, thank you so much for joining us for this Real Talk. Thank you for all the work that you're doing at Servicios de la Raza to try to get this information out and try to get as many people insured as possible through this tough time.
Of course. Thank you so much for having me here, giving me the time and opportunity to speak to you.
Absolutely. And that is this week's episode of Real Talk with Micah Smith. We are so thankful that every week you choose to tune in for this Real Talk on issues that impact Coloradans who are often overlooked. If there's a Real Talk you would like to have, please let me know. You can send me an email at micah.smith@denver7.com. And in the meantime, you can find all of our shows on denver7.com/realtalk. Have a great day.